Good afternoon, everybody. My name is Francesca Piatto from the European Association of Remote Sensing Companies. I welcome you to the third user uptake webinar, Extreme Temperature Risk, Advancing on SDGs Indicators Monitoring, Reporting and Accounting from the SDGs-EYES project. Today I will be your host alongside colleagues and experts from this thematic. Lauren, you can change your slides. Thank you. I kind of invite you to see and have a look at the guidelines of today's webinar. Please use your full name and organization. This will support the division of the breakout rooms and preparing you if you need any support. We kindly ask you to mute yourself, to use the chat for any questions. You're free to use your camera or not. The webinar will be recorded, so in case you wish not to be recorded, feel free to turn it off. And when invited to speak, I kindly introduce yourself with full name and organizations. Check out the Menti code. We will have 2 Mentimeter sessions throughout the webinar. So you will see this QR code along the slide. And I think that we can move to the agenda, Lorena. Thank you. So we will start with a short overview of the SDGs-EYES project by Manuela Balzarolo, our SDGs-EYES project coordinator. We will then move on with the pilot presentation and the overview demo sessions from Martelene and Matthias Callas from the CMCC Foundation. We will have a 50 minutes moderated discussions between pilot representative, the audience, and speakers from communities. And then we will have a breakout room sessions of 20 minutes before then move on to the concluding remarks. So that it's said, I will then kindly invite Manuela Balzarolo to take the floor. Thank you, Manuela.
Thank you, Francesca. Can you hear me well?
Very well.
Yeah. So as Francesca mentioned, I'm the coordinator of SDGs-EYES project. This is an Horizon project that aims to use Earth observation to monitor different sustainable development goals. We are now more or less, we are approaching the end of the project in the sense that the project will end by this December, and it started in January 2023. And you can have more information on the website about the different project. And in this presentation, I will give a briefly introduction of the general aim of the project, and I will leave Marta and colleagues speak more about the specific application on Pilot 2. Please, next slide. So, okay, this is a project organized and where we have different partners working together, and these partners are experts in different fields. So we have experts in Earth observation like Sistema, and as such we have the University of Wageningen that is expert in Earth observation but also in capacity building, and we have ERSC that he's organizing this meeting webinar as well, but he's in charge also of the uptake of the project. And we have also local organization like ASTO3, that is the health service in Italy, and they are in charge of providing data for the developing of this specific pilot 2 of this webinar. So and we have also like stakeholders, potential stakeholders, like a project forest design in Romania. So next slide, please. All together, we want to, we aim it to build up a scientific, technological, and a framework where we put at the center the user, because in this organization, it was very important to have the feedback during the project development from the users. So from potential stakeholders that are interested in the use the tool that we are producing. In particular, in the project, we aim to create a portfolio of tools for decision making. And we focus on 3 specific SDG indicator SDGs that are 14, 13, and 15. And these are all related to the European policy on mainly on a Green Deal. And as you can see from these infographics, so we have 4 main blocks. One, the orange one is the driven by science. So we have a team of scientists that develop the SDGI workflow, and with the support of users, and we put all this the developer workflow in a common platform where we can interact and create and test the use case. The use case are defined by the different pilots, and we have pilots in different areas. And today we will focus on the pilot on extreme temperature and risk. Can you move on also on the one of the big, we rely on this project on the use of different kind of Earth observation. So that's fine. Under the Earth observation, and in particular, we use different Copernicus services, and these data are the base of our workflow. And these data are integrated with different techniques for data processing and with in situ data as well. So if you can move to the next slide. And here it's just a map with the indication of a different test area or pilots. And just to tell you that today we focus on extreme risk temperature, the pilot located in Italy, on the city of Turin. But of course, we have other pilot. One is in climate, it's about climate security in Sahel countries. Another one is in south of Italy for GHG emission from fires. One is in Romania, and it focuses on forest cover and erosion. And the last one is in, it focuses on the area of North Sea, and the aim is to create a tool on eutrophication and acidification. So this is a very brief introduction, but I would leave the floor to colleagues that are developing the pilot on extreme temperature risk, because because they can tell you more, and they can also give a very nice overview of the tool that we are developing in the frame of this project.
Thank you very much, Manuela, for this presentation. So before moving to our 2 speakers, I would like to give a short follow-up to Manuela's presentations about the purpose of these user uptake webinars and the kind of expectations that we can set with you. The user uptake concept within the SDGs-EYES is a very important task to demonstrate how this methodology can be enhanced to develop a scientific and technological framework to build the robust, reliable and accurate indicators. We want to showcase the SDGs-EYES platform capabilities, and this can foster engagement with the community, but as well to collect and integrate users' feedback to then support the uptake and the future exploitation of each of these SDGs-EYES pilot. And in this way, this approach, it's really based on a co-design approach, right? So in the first part of the project, we set the stone with co-designs, technical workshops, and then we are now moving with these webinars towards the alignment with user expectations and how they can be exploited. So indeed, in each of these webinars, we really look forward to have as many stakeholders possible with multiple solutions that can feed each other's solutions. So with this, I will then give the floor to Marta Elena, PhD and researcher at the CMC Foundation, and then afterward to Matthias Callas, urban climate data analyst as well at the CMCC Foundation. So Marta, the floor is yours.
Perfect. Thank you so much. Can you see my screen? Perfect. Thank you. Good afternoon, everyone, and thanks to be here with us today. So this presentation will be around like the main objective of our pilot, just to contextualize what we are gonna work on our webinar later on. We decided to focus on the city of Turin, since we started a collaboration with the ASL Torino 3, the health agency of the city of Turin, several years ago, since they have a very interesting data set who merge health data together with, let's say, socio-economic and anaggraphic data of each individual within the city of Turin since 1972. The reason why we also choose this pilot is based on what the literature state of the health says about the heat nexus in Europe. So the nexus between heat and health, of course, in urban areas. And as you can see here in the slide, in the upper part in the right side, you see that from the study developed by Gasparini et al. Several years ago in 2015, Italy seems to be the country most affected by extreme heat attributable fraction of mortality along all these countries worldwide. Specifically, other studies, thanks to the Lazio, that is the epidemiological study of the Lazio region, but also others, state clearly how the northern regions reached the greatest excess in mortality due to heat in the past years. This is the reason why we decided to focus on Turin, looking at this nexus between heat and health. As Manuela was expressing before, the intention here was to try to test with open access data through Copernicus if there are other indicators who can best complement this original indicator that in our pilot is called mean near surface temperature deviation. Actually, this indicator have been cancelled from the Eurostat, let's say, list to monitor the urban state at the beginning of the project, but still we decided to keep it since the focus on heat and health in urban context is fundamental in order to understand which kind of strategy to implement with priority in relation to heat stress. So the objective of this pilot... So the objective of this pilot is actually to calculate several indicators and to use as a proxy in order to include it as a hazard into the risk framework to consider the heat risks in the health of the population within the city of Turin. And in doing so, we use open access data with high resolution and across different spatial and temporal domains. So the expected results of this pilot are mainly two. The first one is related to a platform who contain all the codes provided by a colleague of us who is developing these indicators with Python scripts. And the other outcome is related to tool decision making that we want to, let's say, make it very friendly and open in order to make good use of it so as that the decision makers, especially the local ones, can apply the pilot and see at the census tract which are the main, let's say, area to focus on and for which priority. So the stakeholders we included into the pilot are several, and as Francesca was mentioned before, we involved them since the beginning of the project, as you are doing right now, so as to collect feedback and improve our two outcomes, therefore the platform and the decision-making tool. Just to show you briefly the workflow, we started with the analysis of which indicators could best fit our purpose, therefore the hazard indicators to include in the risk assessment framework to the heat nexus. And in doing so, we collected 12 indicators and we calculate them, and they are available on the platform. And we calculated them through 3 open access datasets: ERA5 Land with a 9-kilometer resolution, Serra with a 5.5-kilometer resolutions, and VHR, that is the highest resolutions possible in Italy right now, 2-kilometer resolution, and is a CMCC dataset who is available open access. To be sure to replicate the analysis over other contexts. So in this case, we decided to focus on a shared analysis period that is from 1991 to 2020. So from that, as I mentioned before, we calculate these 12 indicators, and we also include ERA 5 lens, so as to be sure that this kind of analysis can be replicated also to other contexts outside Italy. Of course, if we are considering, like, say, European countries, a resolution of 9 kilometers does not seem so good in order to see the differentiation across the city. But if we consider other cities, such as, for example, Lagos, it's very important to consider this kind of resolution, because this kind of data are available, let's say, worldwide. So the replicability of this is quite big. The outcomes coming from the hazard analysis are mainly open access coding available in the platform, time series to download, and also other data that are downloadable through CSV, shapefile, and PNG. In order to test these indicators, we decided to collect the data from the, let's say, early warning system within the city of Turin and of the region. And we try to understand through a performance diagram which kind of these 12 indicators best fits in relation to the alert or local alert of the city. And as you can see here, where there is the round in the upper part of the diagram, these are the indicators that for now passed the selection. Therefore, we decided to include these 4 indicators among the 12 selected at the beginning in the risk assessment framework, and we decided to merge them with all the data that are to date available to understand the nexus between heat and health at the urban scale. Therefore, demographic variables, socioeconomic variables, health data, environmental context data, therefore how far we are from the river, what is the percentage of urban areas in that specific census tract, and so on and so forth, and also the neighboring facilities. So based on all this data, we have been able to structure the framework of the risks. The framework of the risks is actually based on the assessment report 5 of the IPCC, who consider the risks as a merge of 3 main factors: hazard, that in our case as the heat stress indicators; exposure, that in our case are the population over 65 years old, because from the literature, it's clearly how they are the most affected within the context of Turin. And finally, the vulnerability factors, who pertain the social, demographic, and economical aspects of the exposure sample, therefore the population over 65 years old, as well as the context of the city who surround the people living the specific census tract within Turin. In order to do so, as I mentioned before, and as Emanuela and also Francesca said clearly, we decided to approach a co-design, let's say, process, so as to be sure that we can provide the best available product to date based on the data and the knowledge that we have. Therefore, another colleague of us that will speak later, Nicolas, he provided a survey to the expert at the local and regional scale in order to collect information on how this indicator can weigh actually on the final mortality based on their experience. Therefore, we included also the weight of each indicator pertaining to the vulnerability factors within the risk assessment framework. This permits us to construct this kind of pilot workflow, As you can see here, we are starting from climate variables. We calculated the indicators in the blue column. From this calculation, the users are able to download shapefile or CSV or PNG due to images for this time series related to these indicators over the city of Turin, but the replicability, of course, of the code is also pertaining to other contexts. And thanks to the performance diagram, we are now able to merge these 4 indicators with all the indicators pertaining to the exposure sample and the vulnerability characteristics, so as to see how the risks actually change in relation to one of the 4 indicator who passed the selection in relation to the heat stress indicators, of course. So just one word before passing the floor to my colleague Mattia. In here, this is let's say, a draft, a pilot draft of the platform that we are available right now, and this is almost quite to the final stage. But we are here today also to collect feedbacks from you in order to understand how we can improve this kind of decision-making tool. As you can see here, you see lines in blue, red, and green. In blue, you see the main districts of the city. In red, neighborhood, while in in green, you see the health districts. And we included this in order to also provide information who can be useful to the health decision maker across the city. In here, you are able to click on each specific census tract to select in the left the specific indicators, but also the factor pertaining to the risks, so as to see clearly in each census tract which is the portion of the risk factor who pertain to that specific risks, final risks, but also how much the vulnerability characteristics weigh on that specific census tract. With this, I thank you. In case you want some reference, we can, of course, provide you the presentation, and I pass the word to my colleagues, Mattia. Thank you.
Good afternoon, everyone. So I will share my screen to start, let you see the platform in an interactive way. I hope everyone can see this. So this is the platform that Marta shows a little before. And right now we have 4 hazard indicators that were calculated from one dataset, that is VHR REA. The other 2 datasets will be integrated in the next months. And clicking one of the hazard indicators, you can open the overall risk in the city of Turin, calculated with the methodology that Marta has exposed. From here, you can select the overall risk, the overall vulnerability, the overall exposition, and the hazard indicators. So for every of these 4 risk scenarios, you can see all the data splitted. Clicking in the census tract, in the desired census tract, you can open 2 graphs. One is a pie chart that shows you how the risk is composed, so which is the weight of hazard, exposition, and vulnerability in the selected census tract. And in the bar chart below, what is the distribution of the vulnerability indicators. Clicking on each vulnerability indicator, you can also open an overall vulnerability map of the selected indicator. We had some features that are related to orient the stakeholder which want to see and study the dashboard. So you can select the neighborhood or the constituencies of the city of Turin and the health district of the city. So the dashboard allows you to see all the indicators at the base of the census tract, but there are some open issues that we are interested in dealing with you today that are related on the replicability of this risk assessment tool. First of all, the 4 indicators that you see here, that are maximum temperature, heat waves, summer days, and tropical nights, are the 4 indicators that were validated through our validation process. So in the case of the replicability in another context, we should understand how to validate the climate hazard indicators. Especially, for example, in our case, we adopted the confrontation with a local early warning system and some statistical comparison that are needed if you are going to replicate in another context. Another important topic about the dashboard is the data availability at a micro level. Here in Turin, we had the possibility to have all the vulnerability indicators. Here also you can see a selection because at first they were more than the ones you can see here. And this means that replicate these tools means to have access to the data. Especially health data can be tricky because they required and they impose some privacy constraints. So how to overcome these barriers. Another topic important that we'll dealt during the day is about the weighting procedure of the indicators. As you can see here, the vulnerability indicators have been weighted to avoid an underestimation of the indicators. So also, these kind of procedures should be understood and adapted to other cases in the case of replicability of the dashboard. So other features that are actually being developed in the platform regard also the possibility to change some feature like the background, and in future we will have some modifications that are related to the adding of the other dataset. So you will have the same for indicators split into 3 datasets that are the hazard data of adopted for the study, and probably another some kind of front-end modification based also in your feedback. So I think that this is everything from my side, and thanks.
Mm-hmm. Thank you very much, Mattia and Marta, for this very nice excursions before and the actual visualization of the service online. I will kindly now ask you to provide some minutes to answer some Mentimeter questions. These are some common questions that we ask at the beginning of each webinars, and that will support the moderated panel discussions in a few minutes. So I would ask you to use your phone and use the QR code. Let me know if you can see everything my screen, and then I will perfect, thanks. And then I will kindly ask you to fill in some of these questions. Thank you very much. Okay, and we will be able to see already the results online. Okay. Okay. I know that today we should have a very nice overview between private and public sector, with many municipalities as well involved. So it's nice to see this representation. Okay. Who do you think is the main beneficiary of the pilot service presented in this webinar? This is, let's say, the golden question that we wish to ask. And we will start with our presenters. Okay, regulatory government, academia. Okay. Okay, so overall the regulatory government categories. That's perfect. What are your expectations from this webinar? Do you want to gain insights? We already asked this question as well in the registration form, but perhaps by already listening some of the key features of this pilot, you can already have some further considerations about the expectations. Okay, update on the advancement. Okay. 65 best practices. Okay, Monica, are you taking a look at all the different questions and the replies already? Okay, and then the last questions is, to what extent are you familiar with this pilot service discussed? Okay, 50, okay. Okay, somewhat familiar, not familiar. Okay, so I think that I will stop here, Mentimeter. I will then pass the floor to our technical moderator, Monica Miguel Lagos. So Monica, I will give you the floor, and Lorena will ask you to share the screen with our panelists.
Yep.
And of course, I all welcome you to the floor.
Thank you very much, Francesca, for the intro, but also to Mattia, Marta, and also Manuela for the overall overview about the project standards and how this pilot is proceeding. So, as Francesca mentioned, the intention of this panel is just to bring on board other stakeholders, which, because their typology of organization are close to the subject, or also because they are also performing other pilots or activities close to the the relation of these activities. So today we have on board this type of experts, so we welcome all of them, and we try really to go for elaborating on the main barriers, also challenges, and also discuss a little bit about additional studies that are taking in place in the different regions. So with all this expertise, we will have Alison De Luis from the Covenant of Mayors, Ms. Dr. Francesca Donato from the Department of Epidemiology of Health Service in Rome, Julia Mellis from the List Foundation, and Frederick Waterhall from the European Center of Meteor Range Weather Forecast. We will also have on board people from the audience, which is also, we call it active contributors, because also for the nature of the organizations, they are related to the contest, and they could have complementary discussions. So let's try to bring this panel forward, and let's try to call first to Alison De Luis. It's Manager of Adaptation to Climate Change. She's co-leading the activities in the Covenant of Mayors, working on building the adaptation capacity across the European cities, but also in their focus, they are looking into the space-based services and also energy poverty. So thank you very much, Alison, for accepting this discussion and the panel. And we would like to have this overview from the municipalities, obviously from the Covenant of Mayors that you represent. So basically, from your perspective, what do you think will be the key conditions to ensure this type of services that you can see presented today, but also I understand that you already have this context in other frameworks, how these type of activities could be successfully adapted in the local context, so in the municipality perspective?
Okay.
Let me know your views. Thank you.
Thank you. Well, first of all, thank you very much for inviting me and the Covenant to be part of today's webinar. Just very quickly, in case people on the call are not familiar with Covenant, we're a European Commission initiative. We're 15 years old this year, and we support local authorities across Europe to achieve their 2050 visions of decarbonised and resilient cities with access to affordable, secure and sustainable energy. So we've got about 11,000 local authorities that are signatories. A couple of them are on this call, so a shout out, I see Worms and also Maribor, and there may be others. We have about 240 million Europeans, in a sense, covered by signatories. So back to the question. We've been working with our community the past 18 months to explore the opportunities and challenges around how to ensure that Earth observation services are able to be used. And let me say up front that there is actually a real curiosity and interest from the local authorities we've spoken with, and particularly those that have not yet started using the services. But we do note quite a range of challenges and barriers, which I am grateful to be able to share today, given that some of the people on the call are in the Earth observation community. So just, I'm going to mention just a few. Let's start with awareness. We first need to address the issue that actually some of our local authorities are not even yet aware of the potential value of Earth observation services. So webinars like today, awareness raising is really important to start to bring Earth observation a little bit closer to our community. And we also are noticing in our conversations, there's actually a bit of a mismatch between what space-based service providers understand the needs of local authorities are, as well as particularly their capacities. And I'll get to that in a moment. But also then there's the lack of awareness on the side of municipalities as to what are the existing services that are already developed out there. And I think we're hearing more and more that actually some of this challenge is there's actually a lot of services out there. And so for a local authority, they're saying, well, which one's the right one for me to meet the needs I have? Let me move quickly then, capacity to use. This is another big challenge we're hearing. So there is great heterogeneity in European municipalities. We've got thousands and thousands of them. They're not all sort of big cities like Milan and Paris. Many, many, many of them are very small local municipalities. So they have very different capacity. They have different sort of number of staff, access to equipment, services. So these data services need to be designed to be accessible and usable by non-technical experts. And sometimes we're hearing that some of these services require a little bit too high a technical capacity. Sometimes that's in relation to translating the data from these services into information that then these local authorities can use to make decisions. So that's a bit of a challenge. And then the final thing I'll mention now, and then I'll hand over to my other panelists, is they need high resolution data. And I know that was mentioned in the earlier presentation, particularly if you're thinking about heat. it really is very, very local. And so that high resolution is important. And we know that many of the commercially available services actually provide that. Some of the more public good services, open access ones, don't yet do that. But cost is a barrier for local authorities sometimes in being able to actually pay for those commercially available ones, particularly for smaller ones. Final thing I'll mention is we also hear that most of these services are only available in English. I'm a native speaker, I'm lucky, but it's a real barrier, particularly for small municipalities. So I'll stop there. There's many more things to say, but I'll pass on to my fellow panelists.
Yeah, thank you so much, Alison. It's great because also you are pointing this awareness, understanding the capacity, the capacity at the different regions. So bringing, we know that we have people of the audience from different municipalities, also in size perspective. We will have breakout sessions. So we will maybe can expand there from these municipalities also to take the floor. So we have seen now a little bit few points that Alison mentioned from the municipality point of view. We will move now to the health system because also we consider them to the users community. So bringing on board Francesca is a climatologist, environmental epidemiologist from this department of Lazio. So Francesca is based in Rome and her research is on estimating the health effects of extreme temperatures and climate change with the focus of exposure on modeling and also identification on vulnerable groups. She's also managing the Italian National Health Adaptation Plan and governing systems on behalf of the Ministry of Health. So a big background on her shoulders. So from you, Francesca, thank you very much for accepting the call today. So from this pilot perspective, you have seen now, I mean, obviously it's jumping on the presentation, but how do you feel this combination of EO-derived indicators with demographic data that has been represented by Marta and Mattia and health data in terms of improving this predictive accuracy in the health heat health risk that you have seen in your units? How is your experience bringing all these indicators? And also, I will say maybe if we could expand also on challenges and opportunities from this perspective. Thank you.
Thank you, Monica, and thank you for inviting me to all the SDGs panel and group of researchers. It's a pleasure to be here today and see the results that are being produced by the technical groups. So just to add on what Alison was saying earlier, I would say that one of the main, I mean, obviously it's important, and within environmental epidemiology, we have been combining and using EO-derived indicators, so from Earth observation, because of the additional information they can provide compared to observed data, which are not readily available in all areas, or the spatial resolutions that really cover what we need from a health perspective. And it has been evolving quite quickly in the last, I would say, 20 years. And so it has been a great advantage for us in the types of studies we can look at, not only because it's not only big cities or where data is available, we know a lot more about rural or suburban areas. We can also characterize the spatial, within a city, the spatial differences, both of exposure and of impact. So it's really important for us to measure what we do in epidemiology is estimate the risks, and so what the health impacts of different environmental exposures can be. It's important to have long time series of data, accurate data, but also good spatial resolution. So following on what Alison said, it's important to have a very more and more fine spatial resolution. But again, it's not the only parameter as well. We don't want to go too specific, because then we have the issue of the health data that we don't have at that fine resolution. So it's always trying to find that balance. And again, the awareness of what data is available and how you can use. I come from a climatological background, and I work in the health field. And at the beginning, the issue of, explaining what data is available and what you can use and what actually makes sense, and understanding what the health service or health system also needs from public health perspective. So I think it's a good way of collaborating and using this data and combining and showing how you can apply the different data. From an EPI perspective, I think one is research, and so producing more results, more exposure, more consistent results on what the health risks related to climate exposures are. On the other hand, it's also monitoring of what is actually going on and what is the exposure, what are the risks, and having that at a spatial resolution, because we also do surveillance and monitoring. So we don't always have to have a risk estimate. We also like to see what is going on, how things are changing within a city, within our public health districts, where areas most at risk are, where we need to target our resources, where we have to implement further resources and adaptation and action measures in terms of public health response, prevention as well. So it's a different settings that these data can really be used and can be useful from a public health perspective from different people who have different knowledge, different awareness of the risk, but also different, let's say, expertise in using the data. Not everyone has, is familiar with a NetCDF file. They might just want to look at a map or just need a very, very standard table. And then they need further experts who will do the analysis, which is more, let's say, the epidemiological side of things. We need the actual data set in a format we can use. So I think there's different levels of data and applications we can have. So I think this example in which you actually show how you can combine the data, use the data based on current applications in a current setting is very useful from a public health perspective.
Thank you, Alison. So just maybe because both Alison and Francesca, for both of you have addressed the topic of usability. From what Mattia presented now, what do you feel? Give us a quick feedback. Like, is something that is easy to maybe interpret by the urban specialists, or maybe through the more in the healthcare system? What do you see as a fair view, as a first glance?
Well, I would say, obviously, the example they showed from Torino has excellent data, and they've combined a whole series of data, which, as Alison also pointed out, is not readily available for everyone.
Yeah.
In Italy, as Torino showed, but we have a national project which is currently ongoing, looking at climate change adaptation and mitigation. We're doing a similar exercise in different cities, which the group from Torino, ASL Torino 3, and Marta as well, and CMCC are also engaged in. So it's a follow-up of that in different contexts, but not everyone has the same amount of data that they can share, and there is issues with health sensitive data or administrative data and spatially available data in that context. So I would say that is a really high-end example, and anything that goes further down from there, even if it's just the graphs that Mattia was showing, I think is very useful in the context of a municipality, for example, from a more city perspective, which we also work with. It's not that the health domain works as a standalone system within a city. We work with municipalities, with social services, for example, emergency responders from different contexts. I'm glad Alison is nodding because we share that perspective. And so I think it's useful to, to engage in a more collaborative work when you're responding to extreme climate events, for example, like heat waves or other things. So I think some of that data could be very useful to have a better perspective of what is happening on the ground, where different risk factors are. We've done several work looking at, different comorbidity or chronic disease and how these are, it's not only being elderly or where different vulnerable people may be, homeless people, for example, or other contexts. So having that mapped out is where a lot of the research or the public health domain is going towards with municipalities. Another example I can cite now, in Rome, we have the Jubilee for the Vatican this year. And so we're engaged currently in a lot of work looking at all the different spatial where things are going to happen in our city. Rome is quite a complex city. We have over 2 million people, but they're expecting over 300,000 people a day for the Jubilee and the events at the Vatican. So you can imagine what an extra burden that can be for the city from different perspectives. So I think having this mapped out, all this information currently, without considering tourists and people coming for pilgrimages and mass events, be it a sport event, a religious event, or whatever, can be very useful for the planning of these of any extreme events that may occur. And often can be concomitant. So again,
if I could just add one point, the other thing I really loved about the tool that was shown, the municipalities, one of their main actions is actually communicating with the public about the risks around heat, extreme weather, what to do. And some of these tools actually make it very easy to communicate that to the citizens, to get citizens engaged and involved. And so again, it's not just whole of government working together, it's also about how do cities then engage with citizens to ensure that they're part of the solution. So I think that this tool was a really nice way that that could be done as well.
Just to add one final challenge, maybe, obviously some things are already ongoing, and it's always useful when we see results from different projects or innovative tools is to make sure that they work in parallel or consider what is actually being done and who is managing certain things at local level as well. Mattia and Marta mentioned the heat warning system, which is already present in Turin, and using the same indicators is useful because then it is what is already being applied, I think. So I think a lot of effort should be around that and not proposing a whole series of even more complex indicators, but really work with what is already there because the different users are familiar with that. So I think one of the challenges is really to engage with what is being used and how things are organized in local communities or in different institutions or different sectors as well. It could be health, it could be energy, it could be transport or whatever. I think that is a key issue that really needs to you need to make sure it's embedded in what is already there.
You mentioned before, Francesca, that I will get the question to Alison, but you mentioned that normally municipalities are working very closely with epidemiological institutes or health systems. But being in the overall European context, is that the reality that is happening? Alison, what do you think? We could translate that into many countries in Europe.
Yeah, again, you know, if Gordano, Marco on the call, I can see them. They've been developing heat action plans as part of an Interreg Ready for Heat project. And absolutely the collaborations with health departments, but also other social services, it's absolutely paramount when dealing with extreme heat. So I could say that any of those cities that are taking forward these heat action plans are generally heat health action plans, and we're seeing really great collaboration. But that takes time and resources. It needs to be built into the process and into the culture of sort of really whole of government type collaboration. So it's not easy, but we see the results when that collaboration exists.
Okay, thank you so much. Let me bring someone that is also from the audience. I think is Bernd Egern, is the Senior Environmental Public Health Scientist. I want to complement the vision from Francesca from the health system. So he's representing the UK Health Security Agency. So Bernd, I will spot you there. So we will try to see also your perspective on this. So basically, because you have a lot of experience from the climate change adaptation health systems, but also you have been using satellite data, Earth observation data in overall practices. So having this perspective from the EO side, but also the health systems, what are the challenges or maybe the lessons learned combining these two, I will say, communities?
Yeah, thank you, Monica, for bringing me in. And I'd like to sort of really agree also with your previous two speakers. It's a lot of what they've been saying is also what we've been finding. And there's been a number of projects that I've been involved with over the last few years, both within Copernicus. We looked at basically how fit for purpose the sectoral information system is. Health was one of the foci. And also recently a project where we looked at Earth observation data, the land surface temperature, and how that is applicable for the different health sort of topics. And one thing we're finding is that the data has to be relevant for the urban areas, and often the data comes in, I mean, in situ data has been measured mainly in rural environments, so you need to sort of complement that with an urban heat island effect. And even if you have more high resolution satellite data, it still hasn't got quite the spatial resolution that may be relevant for urban planners. And so we're sort of moving at the moment from maybe 1 kilometer EO sort of land surface temperature data down to maybe 100 meter. And then you start really seeing some of the sort of cutting edge benefits where you could sort of, for example, highlight a hospital or a care home or maybe a prison, you know, where you have vulnerable populations. And then you can sort of mesh that with socio-economic data that also can come at sort of very high and often irregular kind of shapes, and produce maps like the ones that Mattia had demonstrated, which I think are a great way forward for the urban sort of decision makers. Another challenge, and I think also it was briefly mentioned by Francesca, is that from a meteorological point of view, no problem working with NetCDF or GRIB files, but in the health community, that this is quite an obstacle to overcome. And we have a separate system where the data comes in CSV, so that can be read by an Excel spreadsheet, and I mean, that will have challenges of its own, but it means a lot of the urban planners and also the health professionals can sort of get to grips with the data much more easily. But then, depending on what the sort of area is you're looking at, the volume of data can be an issue, and so you want to sort of have like the one you presented, a user-friendly portal where you can say, okay, I just want the data for a particular area, not like for the whole of the UK, say. And so, I mean, there's the Copernicus Climate Data Store, so enables you to process in the cloud. So, those are really sort of, I think, best practices.
Mm-hmm.
Yeah.
Thank you so much. Let me, because you mentioned about the Copernicus climate services, etc. So we also have the ECNWF on board. So let me call Frederick Waterhall. So we'll provide maybe this connection with the data provision side. So Frederick is working as senior science scientific from the forecast evaluation, thematic units, applications, and he's coordinating the European projects, but also focusing on topics ranging from machine learning, for flood, fire modeling, but also health forecast. So let me now bring you on board, Frederick, because you had seen that there was already the contribution from Bernd addressing these data services. So from the ECNWF led services under the Copernicus, so the CAMS, but also the climate change services, how do those are actually serving the local health environmental policies from the authorities, representing maybe exercises from the urban air quality, or maybe assessing the heat stress, etc. So what is the experience that you have in-house already that could be put forward to the different municipalities?
Thank you very much, and thank you very much for inviting me to be here today. I think that a lot of things have already been mentioned during this afternoon. I mean, we are, as data providers, mainly, that's what the Copernicus is there for, provide a service. We do try to make sure that all the data we provide is a good quality and is robust and reliant, so you can always count that the service is providing you the information you need. But however, the information needs to be fit for purpose and usable for the community. So of course, there's a challenge there to make sure that it's the right data that the public needs or applications need. And one of the main issues, of course, for urban applications is the resolution. So we are, as mentioned here already, RF5 land from the very nice application. That's one of the main things we have, reanalysis data. But of course, it comes on quite a coarse resolution. So it's not necessarily directly applicable from the box. You still have to do some sort of translation to application. That can be a downscaling, or that can be something that other types of machine learning techniques to make it more applicable to the smaller scales that you need. So I think that's one important thing, that we are providing the tools that you need, the basic tools. But then it's really like projects like this that make that going from the data to the information. So that's really fantastically excellent example to how you take that information, which is, as Bernd mentioned, is GRIB data or NetCDF data, and you just turn that into something which has a lot more information. This really is the key. And of course, we have use cases that we provide, and we also have tools available. We have not only the data, but we have a user guide. We have user communities. We have also a lot of libraries that you can use. So one thing you can do is to tap into that user community as well, to make sure that you're making most use of the service they provide around the data, not just the data, but the knowledge about how to use them. And of course, also the limitations of the data. We know that the data is just one part of the process, and you need to understand the limitations and the quality of the data as well to make sure you don't make unnecessary claims or false claims because you're not using the data to the best knowledge. Sorry, Monica, you're muted now.
Sorry for this. Yes, indeed, Frederick, I like that you point this practical. No, let's go from the pilot exercise to make it more operational. So this example uses. So how often then the ECNWF is using these cases to make awareness, maybe in their events? Or is that something that you are picking in the different projects that they are using already your data sets and making them more visible, or?
Sorry.
See, the connection is that you mentioned about that it's good to have these use cases for the Torino cases. So how often is that you pick up these cases and expose them into other environments?
Yeah, so well, we do have specific ways of doing that. For example, we have the Copernicus Health Hub, which is a knowledge database or knowledge store where projects like this can be part of the use cases that we provide as well. So it's about making good examples on how to use the data. And the more open everything is, you mentioned here already, it was based on Python, and it's an open library, and that can be, so it's reusable and it's reproducible. Those examples are really, really good, really nice, because then you can say that, okay, this is an example done for Torino, but how do we then use that in other areas? How can we transfer that information to other areas? So the more that you build things that are generic, that can be, of course, you need the local data and local understanding to build something, a beautiful platform like that you just shown. That doesn't go very easily, but you can at least show some user experience of how that's be done. But also you mentioned projects. I'm involved in projects called Trigger, where we are building a similar kinds of tool, which is also based on using climate data connected to health issues, air quality, heat, stress, and so on. We haven't come as far into that project as you have done in this one, so we're still working on the co-design. Yeah, co-design is one thing that, of course, you need to have. You need to have the local stakeholders involved to make sure that they get the most out of the tools you're building, so they're understandable on different levels. And can I just mention on the stakeholders there as well, because it's very important to understand who you're doing this for as well. So this use cases has to be targeted towards a specific stakeholder group who have different needs and different understanding of the problem. If you're talking about the public, maybe the information needs to be on a very sort of easy to digest level. If you're targeting medical people, you need to make sure that they understand the implications, that they understand. And if it's policymakers, they still, or decision makers, they need to have a specific tool that they can maybe use for taking the best decisions in front of a heat wave. So that's very important to understand the user community or the stakeholders in order to do that.
Yeah. Okay, thank you. You mentioned about the complementarities with different activities that are going forward. We will come back to you on this, but let me bring on board Julia Mellis, is project manager from the City Climate and Environment at the Links Foundation. So normally this Links Foundation is putting sadly this research into operational, so it's bringing really the users. And I think Julia is a clear example on how to bridge with the different communities, so the municipalities. So thank you, Julia, for being with us. So for me, the first questions will be based on your experience with municipalities, but also what Alison already put forward with the very clear points. Maybe you could base your question on and complement what Alison provided, but it's about the same. It's really about the challenges that you feel these communities are facing using the urban head data, and also addressing this gap. So Alison, make it this very clear perspective. So now from your already experience with Milano, with Torino, but also working with Milano in other projects with the complementary activities, what are your views on this?
Yeah, Hello, everybody, and thank you for inviting me. It's a pleasure to be here. So while Alison was talking, I was also elaborating on that. And I think we are living at the moment major change because of the impact that climate change, and we are analyzing in specific the extreme heat events are affecting our cities. So if before and extreme heat was treated mainly by emergency services, I think that what we are seeing now is that this is going to be something more structural that has to be tackled by different sectors of the municipalities. And in particular, we are talking about the urban regeneration and green directions inside the public administration. So what is missing is a culture of collaboration on these specific topics. So while I think therefore before there was some expertise in the more operational sectors and the emergency in analyzing this kind of data and also having to deal with real-time data, satellite data. Now this is a very specific competence which needs to be still consolidated inside the urban regeneration units in our cities. So that's the first challenge, that this is becoming something structural, and we are called as experts to assist this process and also to facilitate it. And relating also to what Bernd was mentioning, I think that our I mean, as experts and technical experts, we have to work on this kind of data to make them understandable and usable. And this is exactly what this tool is doing. Because what I mainly appreciate about it is that it is trying to rely on easily retrievable data, for example, climatic data. CMCC has done a lot of efforts to find some data sources that can be easily replicated also in other contexts. For health data, I have to admit that Turin has quite a peculiar situation, because we have a long history of this of collaboration, and I can say there is a community of practice here which conveys experts from different background, and we are really trying to work together. So we are still best case in this regard, and more should be done to facilitate this replication also in other cities, also for what concerns the health data. I add also that, in my opinion, going a step forward with this tool, and also trying to prefigure what some solutions could be. So to be able to complement this knowledge about the status quo with some ideas of possible solutions could make these results even more understandable from the decision makers. And at the same time, this tool could be really helpful in participatory processes, also to involve non-expert public.
Indeed, thank you, Julia, for complementing also the few topics that Alison or Ben were addressing. So, because we're looking about this, maybe this complementarity, the co-design approach that they bring in different people. Let's go back to Alison, because Alison, you are leading these efforts to enable the combined cities to access the use of space-based services. So, we know that there are initiatives going around the Covenant of Mayors that you would like to address. Could you let us know a little bit about these actions that you have, or which are you see the most immediate maybe opportunities for the community to be close to the Covenant of Mayors, these activities? So thank you.
Yeah, okay, let me mention two things. We've been working closely on this sort of Earth observation topic, as I said, for 18 months, and we've been working with USPA, but particularly also with the European Space Agency, and they have a group of people in a sort of initiative called the Stakeholder Engagement Facility, who are working closely with us to really try and start to build some capacity, some awareness around Earth observation. We're developing some sort of modular training programs, really trying to sort of help local authorities at all different sort of capacities start to play around. Again, some local authorities are already doing lots of things in this space, Torino obviously, but many are not. So you know, on our website, we've got an Earth observation page. Please, you know, keep an eye out, and when this training program comes out, it's just an opportunity for local authorities across Europe to start to play around and when I say get their hands dirty, fiddle around with data, with materials, and start to see what these services might be able to do. We're also always looking for opportunities. Anyone on this call that's in a Horizon or some sort of European project that are looking for pilot cities, that's a great way for our community members to start to get engaged. Of course, there's resource costs, but at least there's not the costs of having to pay to develop the services. So we're always interested in trying to match our cities with pilot projects. That's one sort of area. The other thing, on a very sort of topical, I guess, thematic area, we just launched our new campaign last week. It's called Cities Hit Refresh. It's a 6-month-long campaign, and I'll put in the chat the links to the campaign. And really, it's around trying to raise awareness around this topic of extreme heat. And so it's got sort of 3 main focuses. It's trying to sort of say, why is this issue of major importance? Because again, on this call, we all know it's important, but actually there are many parts of Europe that are facing this for the first time. So we're trying to raise awareness. Then what we're really trying to do is showcase the inspiring examples that are already being undertaken, the actions of cities across Europe. If they're using Earth observation and some of these tools, we really like to emphasize that. But really it's about sort of inspiring action, showing what can be done even with limited budgets, even with small municipalities, so that we can sort of encourage replication. And then we want to very much also sort of raise up to the European level what more is needed to support them. And when I say European level, I also think about many of the people on this call. What are the things around extreme heat that our cities still need, and in this area around data and information, data, you know, that's translated into information. So we're going to produce some maps of stories from different cities. We're going to have events and workshops. We'll have a kit with really useful resources on extreme heat for our partners. And so, as I said, anyone on this call that's interested in engaging in that, I'll put the links into the chat. So these are just a couple of things. There's sort of our work around Earth observation. There's our work around this campaign topic. And then what we're trying to do within what we call our sustainable energy and climate action plans, which all of our municipalities need to develop to be part of the covenant. We're truly trying to work out what are those entry points in all of those different steps of the planning, the implementation, and the monitoring process, where data and information can actually be useful to support our cities. So again, just trying to make the links between what municipalities need to do to address extreme heat, and what are the different resources and tools and the broader community have to offer, and really trying to be a connector between those different communities.
Thank you. Well, maybe I see as an opportunity even for this pilot to be connected for future interactions. So definitely we will keep on touch with this. So thank you. I think it's interesting not only for the EO providers that are online, but also definitely the municipalities that we have many on board, I think, in this call. So thank you, Alison. Just let's try to go a little bit more back to the health part. So maybe Francesca, maybe I'm calling you back on this because you are leading this Italian health warning system. So how do you see this type of tools? You've already mentioned about the ECs, the user interface, they should be easy, etc. But how do you see these tools into this decision support system, complementing really these national strategies or municipal strategies? It's not only about the visual component, but really in the decision-making side.
Yes, thank you, Monica. So when we talk about heat adaptation plans and response plans from a public health perspective, but also from a municipality, as we said before, across Europe, but in several areas around the world, heat adaptation plans have been developed more or less nationally. In several of the people that are on this call are engaged in these, but then it also means that there's regional plans because health systems are managed regionally, for example, but then it also means you need to have city-specific warning systems from one perspective, because that sort of identifies when risk conditions are happening, and they're not only warning systems for, let's say, extreme temperatures, but they're warning systems that take into account the effects on health of the population. So it's a heat health warning system. And we use those to then modulate and respond in different ways, from being an emergency situation, identifying who is most at risk is crucial, that we need to do before. So there's a whole series of preparatory phases and preparedness that we need to implement before, and having an idea of how spatially the city is characterized, both in terms of exposure and so of a hazard in this sense. So which areas are warmest? We know there's urban heat island effect in a lot of cities, even in the small ones that Alison was referring to, but also the population is distributed in a different way. Not all the those that are more at risk because they're old, or because they're living alone, or because there's social deprivation, live in the same area. So the more we know about how they're distributed around the city and where resources need to be focused, where we need to intervene, be it through telemedicine, be it through medical doctors going to assist their patients, nurses, and services really on the ground. And the more we can do this in a capillary way, the more the response can be effective, and we can reduce the impacts of heat, which is the goal of adaptation from a European perspective right down to a city level. So I think the data that was shown before, on one hand, is useful because we know more about the local conditions and where, not only in terms of exposure, and so the heat and the hazard that will occur when we have a heat wave, that we can use when then we have warnings, which is something completely different because we use weather forecasts of what is happening in the future. But we know which areas are most at risk, not only from the heat that is going to occur, but also in terms of the population that is going to be exposed to that heat, and how this can change as well. And Julia also mentioned adaptation measures in terms of increasing green coverage, albedo changes, which mitigates the exposure to heat, or opening up areas, shading, etc. And a whole series of more structural interventions that are needed, which have more longer term perspective, which you need to manage. And we're always talking in a world well, from a public health perspective, but I think from all the sectors that we are here today, the resources are very limited and finite. So we don't have infinite financial resources or people that can do the work. It's not only financial resources, I want to add, it's human resources as well. So the public health sector in most of the European countries today is in a very critical condition of limited resources. And so we really have to optimize the resources we have and make sure that we can respond in the most efficient way. So I think both forecast data that has been provided from ECMWF, from our national weather services on one hand, but also Earth observation data and reanalysis models and different models that we have available with the data can really support not only knowing who is most at risk and knowing, having knowledge of where the risk areas are, understanding the climate better and improving our response and our adaptation at different levels. One is the emergency, which is when it's already happening. One is the short-term planning, and then we need longer-term planning and management, you know, which goes beyond just responding to that emergency situation, like Julia also mentioned, which is quite hard because then it entails different actors. And so again, going back to the collaboration, and as well, I think the local community awareness. So I think, you know, co-creation, co-development with different organizations, NGOs, citizen science activities is really crucial in this sense if we want to respond. And we're talking about heat today, but we know that there's different environmental exposures that happen together. You might have high air pollution, there might be drought, there might be wildfires. And the people that are most at risk within a city are the same ones. So it's important that we can react and protect them efficiently with the resources we have. So I think, you know, this engagement and closer collaboration between different institutions and all being on the same page, both from in terms of the experts, but also in the messages and in the communication and the information we give to citizens, which can all be active responders in their own, you know, within their local communities.
Okay, thank you so much, because I like how important is for you really this co-creation activities, and I think somehow the direction is ongoing. Is in this side, and maybe I would like to know the views from Bernd, also from the UK. What is also the plans going through that direction? Because Bernd, I think from a previous discussion we have, you are looking into these future projects that bring these co-creation, co-activities. So building on what Francesca mentioned. So what is the perspective you have in the UK?
Yeah, absolutely. So we are just about to embark on a new ESA-funded project, which will have co-design from environmental health practitioners, not just from the UK, but hopefully also from across Europe, and looking how high-resolution land surface temperature data that comes from satellites can be transformed into health-relevant applications of the kind that you've demonstrated, or maybe even something that can be accessed via, you know, a mobile phone, either by decision makers or by affected population directly. So that's a project that's just about to start. I can put my email address in the chat if anyone is of interested to find out more. I'm very happy to tell you more about it. And yeah, so we have also in our organization a very active GIS team. They're also looking at how to make use of the high resolution temperature data from satellites. So it's quite a few things going on at the moment.
Yeah, indeed. Thank you. Keep an eye. I think all these communities, please keep an eye on the reference that just Alison provided before. Bernd will be, and I think these activities. So Julia, thinking because the co-design part is also coming from your side. So in your experience, what do you think will be the most effective mechanism to foster this collaboration between the different communities?
It's not an easy.
It's not easy.
It's not an easy game, but I think that finding moments where you bring together the people from the different expertise and make them discuss on the same challenge is something that might sound very simple, but I still think that it's the most effective solution, because then you start this collaboration. Each one becomes also curious and learns something from the other representatives, and I think that's really useful to get out of one's own comfort box, just to try to look at the problem from different perspectives. So what we have done in Torino, as I mentioned, is a work that started already a few years ago, So it's not linked only to this project, but it's a collaboration that started, and it started highlighting the importance of health in urban-related decisions, I would say, because that's a topic that now is kind of researched, and it's on the first pages, but that's something that it's a culture that has been created with step by step during the years, and I think this is something, it's a process that it's happening all around Europe and even at global level. Something has changed into urban planning discipline. And to be more practical, I think the best way, because these kind of tools will be used only if they respond to the needs of the public administration and of decision makers. So our first the first step for us is to understand what is their need. So to make it this explicit, and then try to give some answers. And that's more or less the process we are in at the moment. So once the tool is created and we have this interface to release it for some first use, to get some feedback at first, and to see if we are really able to give some answers to the expectations that were elicited before. And also to get feedbacks on its usability and friendliness of the interface, which is again a very simple and obvious part, but I would say that this is also the first obstacle. If a tool is not easy to use and the results are not easily understandable, it will not be adopted in everyday processes.
Yeah. Okay. Thank you so much. So somehow I think we are going back to what Alison said at the very beginning here. So before concluding, and I will leave you some minutes to maybe, because I will call Fredrik for a last question, but I will ask you after Fredrik comment on because he mentioned about the Copernicus Health Hub. So I just wanted to have a little bit more a perspective on that, but start to think about if you have to capture the way forward in a single word, what it will be, just to round it up, the question. But before going to that, maybe the question is still for Fredrik, because you mentioned the Copernicus Health Hub, and I think it's a great initiative. So how maybe, I don't know which will be the conversations internally in the ECNWF, but how could this Copernicus Hub capture all this co-design process, the use cases, the needs and the challenges, how the plans are in the hub to build on this?
Well, the projects like this is crucial to understand more of how the data is being used in the community. So I think it's something that we can definitely practically also connect to the Health Hub. So this project can be, part of that flora of expertise and experience using the data. That's one thing. I mean, the Copernicus itself is very much a top-down project. So when you have these things which are looking at the local needs, that's a completely different type of approach. You're looking at the bottoms-up approach. So you're using the global available data, but then you're really looking at the user needs at the very local scale. So that's bridging this gap between the data and the user needs is really crucial, because that's I really think that's where we're going forward now in the future. We have all these tools available, we have the data, but we really need to make sure that this is becoming more used. So this is a very good example for how to do that. And I think if you want to get a word from me it's been mentioned a little bit before as well. I mean, it's to have more translators between the data and the usability of the data. So people who understand the limitations, and can also speak languages. We talked about this already as well, and that's something that's very important. Semantics should not be underestimated there. Do we understand each other? Do we speak the same when we say something about skill or about predictability or forecast? Do we understand what we mean?
Thank
So
you.
between the practitioners and the
Yeah. Thank you, Freddy, because you are starting this last round about the keywords. So thank you, because I was putting you thinking, having time for thinking, but I appreciated that you already put this forward. So I don't know, I give you some time, maybe Alison, Julia, Francesca, what will be maybe this way forward in a single word for you?
For me, it's something around integration / synergies, finding the sweet spot between these things.
Yeah, thank you so much. Yeah. Maybe Francesca?
I would say collaboration and different perspectives. I think perspectives is one of the key words here.
Maybe Julia?
Yeah, I would say informed decision making and participation.
Yeah, maybe Bernd, a final also from your side.
Okay, prepared for me,
Yeah. Okay, I think definitely, thank you very much. I think it's a good set of words. Obviously, the time is short really to dive in all your experience, but I think we have a glance. So thank you very much for the time. Now we will get back to the normal run of the sessions. We will we'll have breakout sessions now, but still the opportunity to have more discussion with you for the rest of the audience. So back to you, Francesca. Thank you very much again for the panelists. Thank you.
Okay, so I think we are all here. Perfect. So we are slowly going back to the end of our webinar, and we're now addressing some conclusions and main points of today. So I will currently ask Alessandro and Nicolas for 2 minutes wrap up of their own session, and eventually also just main points or main questions that came out, or any idea of possible I don't know, maybe exploitation path or something that or collaborations that came out from this session. So we can start with Alessandro, since we were together.
Yes. Yes, thanks. During the breakout session, we discussed about to navigate the platform for the calculation of climate indicators. So we talked about replicability and scalability of the workflow, and how to use the codes for the calculation of climate indicator in other contexts. We talked also about the resolution of the datasets and about the validation process that we use to validate the climate indicators. So basically.
Very technical questions, but I think that we're the people asking these questions are very happy to do them. And indeed, we're talking with Swiss TPH, with ACRI-SAT as well, that were in our room. So they were very interesting by the project, as one is kicking off a new project in health risk adaptation, and the other representative instead was indeed already involved in urban and climate adaptation project. So I think it was interesting to see from a technical perspective the different calculations. Thanks, Alessandro. And Nicolas, any points?
Yes, so we also discuss about some technical issues concerning the risk assessment tool. We discuss about the replicability, considering for example, the exercise to validate the hard indicators and the availability of data, and the methodology that we use to assign weights. But besides this technical issue, I think, I don't know if the other participant thinks the same things, but we talk about that there exists a lot of similar exercise and experience in other cities in Italy and in Europe that seems to have the same or similar objectives. So we talk about, we conclude saying that it's good to share, continue to share this different experience in order to find synergies and collaborations, and we can learn about what other partners are doing.
Absolutely. This sharing of experience of expressed practices among projects are actually very nurturing. And so thank you very much, Alessandro and Nicolas, and to all the attendees in each breakout rooms. As you know, part of this webinar is, the webinar is focused on user uptake, but this webinar also supported what we call the exploitation path. So these webinars are not just, finishing right now, but they will also support the exploitation team in finding solutions and exploitation routes and paths for each of the pilots. So I will have, I think, 4 more questions for you on Mentimeter that I would like to you to reply to. So you should see again the QR code, and I kindly ask to get connected again. And I will go back. Indeed, you heard a lot about this pilot too. What's your opinion now? Would this tool be useful for your organization? And okay, that's good. So I would like, Alessandro and Nicolas and the team, I think, very useful data to rely as well. Okay. For a purpose of replicability, would you like to be a validation user? This is a very fair point. As you know, at this stage, before the webinar as well, we've asked the different community of users to test the guidelines of this platform, so that could give us user perspective feedbacks. This is still possible to do it. It's an informal way. It's very private, so it won't be shared. But just with the pilot and us. So if you're interested to give further feedbacks on really testing the platform from a user perspective and also from a backend perspective, we will then reach out and have it send it to you. Okay. And then also an exploitation user. Exploitation user, instead, it's really test the platform from the backend perspective. So really what from Alessandro shared in the technical room 1. So really from the Python perspective, with possibility indeed of input your own data and test the platform. Okay, so maybe yes and no. That's very clear. Okay, and then the last question is, what kind of challenges do you see using this service from a methodology perspective, tool, and platform? So if you have any keywords that you wish to share with us, that would be very useful in order to implement also everything that has been shared already in the moderated panel. Thank you. Okay, transferability. Okay. Definition of metrics, localization. Nicolas or Alessandro or Mattia, any comments already on these challenges? Is it something that you see yourself in this, or there are some new challenges that you didn't eventually foresee?
Personally, I think the transferability is the one that can be the most interesting about this pilot from my point of view, because it would also allow us to refine the tool in other contexts. That is fundamental, I think.
I agree. That's great. Thank you very much. So I will close the Mentimeter since also it's 4. So I would thank you very much for joining us. Just a last reminder for our almost final webinar on the 29th of April. We're going to tackle the climate security impacts. And then we will have our final events, our final pilot, SDGs-EYES pilot webinar on the 28th of May. So if you're interested with us to stay with us into this chain of user uptake webinars, you can then register for the next one in April and in May. And then as a final request, we will also share with you a feedback form that we will be using in order to gather any possible interactions for future exploitation opportunities. So we will send you a thank you email with these future links very, very soon, as well as with the recording and the minutes of the report of this meeting. So I would like again to thank everybody, and I would give the floor eventually to our colleagues, Monica, Lorraine, or anybody else who wants to do any final remarks. Thank you.
No final remarks, just again to stress the thank you to all the participants, the panelists for this engaging webinar, and also address this. It is like the synergies part that addressed it many times. So let's work on this through the many actions that all of you are doing from the Addison perspective that you put in the Covenant of Mayors, but also at the municipalities level between the local authorities and also the health systems authorities. So synergies and try to co-design and was also stressed. So thank you very much from my side too.
Thank you very much. We will keep in touch soon. Bye-bye.